Hello, everyone. Thank you for joining us for Arthritis Talks, Waiting for Joint Surgery, What You Can Do Now. I'm Tara Steer, an occupational therapist with Arthritis Society Canada's Arthritis Rehabilitation and Education Program. While we have come together for this event from many different places, I would like to acknowledge that the land on which I am located on, which our Toronto office stands, is the traditional territories of the Mississauga of the Credit First Nation, Anishinaabe, Huron-Wendat, and Haudenosaunee Indigenous peoples. Today, this meeting place is home to many First Nations, Inuit, and Métis people, and I'm grateful to have the opportunity to live with my family and work on this land. Arthritis is the leading cause of joint replacement surgeries, and many of you are waiting too long in pain. The good news is that while you wait, there are significant steps you can take to potentially improve your recovery time, manage pain, and enhance your overall preparedness. Tonight, we are fortunate to be joined by a wonderful panel of experts who will provide a comprehensive view of preparing for your surgery. We have Louise Leiden, an occupational therapist, Wendy Watson, a physiotherapist, and Arlena Weissman, a registered dietitian. Before we get started, a few logistics. This webinar is best viewed on a laptop or desktop computer. If you experience technical difficulties, please email arthritistalks@arthritis.ca for assistance. If you have a question for our presenter, you can submit it through the Q&A button at the bottom of the middle screen. We will try to get to as many questions as possible during the hour that we have together. You can click on the chat icon in the bottom middle of the screen to access the chat and connect with other participants and our chat moderator. If you'd prefer to close the chat, please click the X icon to the exit window. To enable closed captioning, please click on the Show Captioning icon in your control toolbars at the bottom of the screen. Many questions we received in advance followed similar themes, so we will address those before going into the live Q&A at the end of the session. Before we begin, I want to thank our event partners, including Pfizer and others, for their financial support of our Arthritis Talk series. Now, let's get started. A warm welcome to today's experts, Louise, Wendy, and Arlena, who are joining us from Vancouver. Wendy, let's begin with you. As a physiotherapist, you're focused on the physical preparation that is so crucial before an operation. What are your top recommendations for our audience?
Thank you, Tara. So my first tip would be to keep your joint moving as much as possible. You want to maintain or even improve the flexibility of all those soft tissue structures that surround the joint, like the ligaments, the joint capsule, and the muscles, those structures which aren't going to be replaced during the surgery. So focus on exercises where you don't have any weight through the joint, but you're moving your joint through its full available range of motion, and even pushing it a little bit into areas where you might be missing a little bit of range of motion, as long as you're not trying to go through a lot of pain. So, for example, on the top right there, you see a heel slide exercise. You can do this reclined or laying on your bed, and you're simply sliding your heel towards your bottom, bending both the hip and the knee, even using a towel or a strap if you need a little bit of assistance getting into that range. For knees, it's particularly important to work on the range of motion because we know that what you have before surgery is directly linked to what you get back after surgery. So as often as possible throughout the day, bend and straighten your knee. As my second tip is to keep your whole body moving. Motion is lotion. When you've been moving your body, you'll have better endurance, which will help you with your recovery. So if you have limited mobility, you might try something like walking with a four-wheeled walker. You can take rest breaks, sit down on the seat. You might try a peddler shown in the top right of the screen there. So put that in front of your sofa under your desk and get a little bit of range of motion through the knee, more specifically with the peddler. You might use light weights or a TheraBand or even cans to do some light upper body exercise. And if it's hard to think about what you can do to move around more, one thing you can really focus on is how you can sit less. So can you stand up, move around every 25 to 30 minutes throughout the day? We know this is really helpful for overall health. If you are moving around more, think about what you can do to support your joints while you're moving in order to get your heart rate up, get you breathing harder. Walking is great, but maybe you're using walking poles. So the walking poles help to keep you in a better posture. They engage some of your core muscles. They're great for balance and stability. And they also take some of the weight off of your lower body, up to 30%, depending on how vigorously you're pushing through the poles. And that might enable you to walk further with less pain and potentially help you if you feel like you're limping at all when you're walking. A cane is helpful. You'd use it in the opposite side as your affected limb. Pool exercise is great. If you like exercising in water at all, this is one of the best things you can do. Get into the water, and when you're up to your waist, you take 50% of the weight off of your lower body. When you're in up to your shoulders, you're taking 80% of the weight off of your lower body. So a lot of people can get into the water and do much more than they can do on land with less pain. Deep water with a noodle between the legs, cycling, jogging, swimming, walking in the water, any of those are great options. Biking is great. So you're seated, so you're taking the weight off of your joints, but you're still getting good range of motion. You can add intensity or a little bit of resistance as you're able. Some tips around exercise, rather than going for one 30-minute walk, you can try going for two 15-minute walks or three 10-minute walks. It's all an equal amount of exercise. Shorter amounts of activity more often tends to be easier on the joints. If you are trying a new activity or you're trying to increase what you're doing, do it very slowly and gradually. Sometimes you won't know that things bother you until after the fact. And warm up your joints before you get going. It might be by doing some movement exercises. It might be putting heat on your joint, or just by starting more slowly and gradually increasing your pace. Another tip, strengthen the muscles around your joint. This helps to provide stability and support to the joint and can take some of the load off the joint surface itself. And it will give you a head start to the strengthening exercises you'll be doing after surgery. So the important muscles are those at the front of the thigh, which are your quadriceps, as well as at the side and the back of your hips, which are your glutes. So a few different exercises shown here, but definitely if you have the option to check in with a physiotherapist, they can give you a very specific and individualized exercise program and adapt it to accommodate for pain or any limitations that you might have. But just some examples shown here. We have a quad over roll, so extending or lifting the leg when you're seated to tighten the quadriceps muscle. You can make it more difficult by adding TheraBand. There's a couple hip exercises shown here. So a bridge exercise, squeezing your glutes, pushing through your feet, as well as a lift out to the side for the side of the hip. So all of these are examples of exercises, although they might not be the most appropriate for you. So again, the value of checking in with a physio. And keep in mind that when you have strong arms, that will really help you after surgery as well. So do you need to do some arm strengthening, which will make it easier to use your walking aid to get up and down from a chair, a bed, a toilet, all of the places you'll be going. In terms of guidelines, we want to challenge our muscles. We actually want to fatigue those muscles between 8 to 15 repetitions. So you should feel like the exercise is challenging. The goal with this, really, we want to maintain muscle, make sure you're not having any muscle loss if you don't have a big stretch of time before your joint replacement surgery, because it does take at least 8 weeks if you're looking to build muscle. Consider how you move. I encourage people to do even an exercise like a simple sit to stand in front of a mirror to pay attention to how you're moving your body, because we get into faulty movement patterns to compensate for our sore joints. So perhaps that's something like bracing your knees together when you sit down, or maybe it's limping when you're walking. But doing the sit to stand is a good opportunity to practice alignment and control. You can use your arms with the exercise. You can start with a higher chair to make it easier. The focus really being alignment and doing it properly. So you want your body straight, your kneecaps are over your feet, your toes are pointing forward, your knees and your feet are hip distance apart. Ideally, we're trying to minimize those positions where your knees are coming ahead of your toes because that's really hard on the knee joint. A lot of people will find their balance is not as good when they're heading towards surgery. So make sure you're doing something to practice your balance. You certainly don't want to have a fall before surgery, which could damage all sorts of different structures. So choose an exercise that works for you. It's safe but challenging, ideally in front of a kitchen counter or somewhere where you can hover your hands if you need some additional support. Some people will do single leg stand. Other people find that that's a bit hard when all of the weight is just going down through one side of your body. So it might work better to do an exercise like a tandem stand where you're standing with one foot in front of the other. You're aiming to hold it for about 30 seconds. And when that starts to become easier, you can do things like turning your head side to side, maybe moving your arms, putting a bit of an uneven surface under your feet, all good ways to progress this activity. So pain during activity at this stage can certainly be normal. It doesn't mean that you're doing damage to the joint, but you do want to pay attention to sharp or severe pain. We don't want to be pushing through that intense sort of pain. You want to back off. You also want to pay attention to long-lasting pain. Ideally, if you're having an increase in pain during exercise, you should find that this pain comes down when you stop the activity. If instead you're finding that it's lasting into the night, you can't sleep that night, or it's affecting you the next day, that's a good sign that you want to take a better look at what you're doing and see what you can modify. Do you need to take more breaks with the activity? Did you progress too quickly? Do you need to try different exercise? Do you need to check in with your physio? Maybe you need to consider pre-medicating. We know that pain medication taken before exercise can help you to be more active and keep pain levels down. Maybe you need to ice afterwards. Ice is a really nice natural anti-inflammatory, especially at the knee joint.
Thank you, Wendy, for that excellent guidance. Louise, let's build on that. Once we've strengthened our body, we also need to prepare our environment. From an occupational therapist perspective, how can people set their homes for a safe and successful recovery?
It's a great question, Tara, because it's something that is really important to do ahead of surgery. A lot of people, as you mentioned at the beginning, are waiting long times for surgery. And by the time they get their surgery date, then it's this rush to get everything ready. But as one of our surgeons has often said, waiting time shouldn't be wasted time. And there's lots you can do even in this period of time where you are in this waiting period, which can be a frustrating place to be. But using this time effectively can really help you prepare for your surgery. And as you mentioned, getting your home ready is one of the best places to start. Um, some of the things to consider is that when you have a hip or a knee replacement, you're going to be coming home from the hospital with some sort of a walking aid. Generally speaking, about 50% of people will leave with a two-wheeled walker, 50% will leave with crutches. You are coming home with some sort of walking aid. Now is the time to start considering how are you going to move around your home with those walking aids? Can you get from your bedroom to your bathroom to your living room? Do you have a route that you can get? Is there a coffee table in the way? Is there rugs that need to be moved? Those are all things that can be all done well in advance of surgery, and those are things you should be starting to do now. Other things to think about is equipment at home. So and I'll show you on the next slide some bathing equipment, for example, or other equipment to help you with getting dressed. And those things can be used ahead of surgery and can help you be more independent. One thing I've often found is that people may get equipment for after surgery, but they've just bought it or just have it for after surgery. And now they've come home from hospital and they've got all this equipment they've never practiced or used before. So practicing and using this equipment ahead of surgery is a really great idea. Um, this The other thing to consider is around your house. So, how are you going to manage with things like cooking um, and getting to your pots and pans? Perhaps your pots and pans are in a low drawer, like they might be in my house. But if I was having a hip or knee replacement, I'd be moving all of that to counter height, waist height, those kinds of things. Um, Other thing to consider is getting, we're one slide ahead here. We're still on the first slide. But other things to consider is um, having meals set up ahead of time. Thank you. That's great there. Having meals set up ahead of time. So use this time as you're waiting for surgery to stock your freezer, get some canned soups, get those sort of things in your home so that when you come home from hospital, you're not worried about meal preparation and things like that. Speaking of equipment for home, as I mentioned previously, there's one thing to consider, especially, is getting on and off lower surfaces. So, generally speaking, for having a hip replacement, you may be required to sit on higher surfaces, and in the sense that you may have to sit on things that are about 2 inches above your knee. If you're having a knee replacement, if you have low chairs and low couches at home, um, that's going to be difficult to get on and off those chairs and couches after surgery. So, a good thing to do ahead of surgery now is start to look at the surfaces you're getting on and off at home. Stand beside your couch, stand beside your bed, stand beside your toilet. You want things about 2 inches above your knee. So, you can use things like high density foam cushion, as in the first slide, the first picture there. You can get those from places like the Foam Shop and medical supply stores, and they're firm cushions that allow you to put it on a couch or your in your car, and it'll raise up that surface. Other things you can think of, and this is a great one to do well in advance of surgery, are using things like bed blocks. You can get these at medical supply stores. Sometimes you might find them at places like Walmart or other home stores. And these are generally wood or sometimes plastic. They come in a set of four, and you would put them under the four legs of your couch, the four legs of your bed, whatever you need to raise up. That's not something you necessarily want to rush around and do right before surgery. So now, when you have this time, use that time to set those things up. In the bathroom is probably a spot you need the most amount of equipment, or it might be a spot that's as challenging. Um, and toilets typically can be on the low side unless you have particularly high toilets at home. Again, so that you know, go stand beside your toilet. You want it about 2 inches above your knee. In that picture there, there's a raised toilet seat. They come in different sizes, different shapes. Is your toilet round? Is it elongated? Do you need arms? Do you not need arms? These are some things to consider for your home. And it's a great idea, if you're going to be using these after surgery, to have them in place, practice with them, make sure you can use them independently. With regards, just to add on to the bathroom, is bathing. A lot of people have questions about bathing after surgery. Um, Typically, most surgeons will give you a waterproof dressing and you may be able to bathe right away. Obviously, you have to follow whatever your surgeon recommends, but getting in and out of things like a bathtub can be challenging. If you have a walk in shower at home, that might make things a little bit easier, but lots of people may have a bathtub. So, how are you going to have a shower in your bathtub and step in and out of that tub? So, one one device or one piece of equipment is called a tub transfer bench, is shown in this picture here, and it has two legs in the tub, two legs outside the tub. It's height adjustable, so you can make it 2 inches above your knee. If you were planning on using something like this after surgery, this is another good one to set up ahead of time. Practice with it, even go in your clothes, if nothing else, so you feel comfortable using it. If you had a bathtub that had glass shower doors, you wouldn't be able to use a setup like this. So you would want to remove them, hang a shower curtain, and also maybe have a handheld shower hose so that you can independently bathe yourself. Again, these are all things that can be done well in advance so that you're not worried about it as you're getting close to the actual surgery. The second picture there is of the raised toilet seat. And as I mentioned, different sizes, different shapes. Again, you want it about 2 inches above your knee. And the two pieces of equipment on the right-hand side are some pieces of equipment to help with you getting dressed. So putting on pants, putting on socks. Here we are in June, ideally nice weather, but maybe by the time you go for surgery, it might be wintertime and you need some help with your socks. So using something like a sock aid you can get at medical supply stores can help you put on your socks and be independent. The reachers are great. A lot of people use them for obviously getting dressed, but also picking up things from the floor to avoid, bending too far and those kinds of things to just make it easier on your joints. And those can be purchased at medical supply stores.
Okay, thank you. That is such practical and important advice, Louise. We've covered preparing our bodies and our homes. Arlena, let's now turn to you and ask how we can prepare nutritionally. Nutrition is often overlooked, so could you share how diet can impact both surgery preparation and recovery?
Okay, absolutely. So I want you to think, what are you eating? Are you eating well? Think about everything that goes on with regard to eating. If you haven't been eating optimally, well, it can delay your surgery, it can delay your recovery and wound healing. So this is something that people don't think about. If you've had unwanted weight loss within the last 6 months, how much has that been? If it's been 10% of your usual body weight or more, that's a little red flag. I would get a referral to see the outpatient dietitian. So what can a registered dietitian do? They can help you assess why you've lost that weight, identify nutritional inadequacies, and hopefully make a plan, suggestions on how you can improve your nutrition, taking into consideration who cooks, your food preferences, your finances, and making it realistic so that it'll work for you. The newest Canada's Food Guide, which came out just before the pandemic, is a great tool for people to use and reflect on, do your meals resemble this in any way, shape, or form? So think of what you're eating for breakfast, for lunch, for dinner. Are you eating 3 meals a day, 4 meals, 2 meals? What goes on for you? And is half of what you eat comprised of fruits and vegetables? A quarter of what you eat made up of protein foods and a quarter made up of whole grains. Make water your drink of choice. We know people drink a whole lot of things besides water. If you want more information, you can click online on Canada's Food Guide and click on the different sections and you'll be led to more information, which is really good. This has been a tool that has been fortified during the pandemic, so take advantage of it. Really good to reflect on, does your diet need some improvement? Oops, wrong forward. So what to pay attention to? Lots of things come into play when we're talking about recovering from surgery and wound healing. So protein, calories, having the right vitamins and minerals on board, eating good healthy fats, ensuring there's enough fiber and fluid to help with healing and to combat the consequences of some of the pain medication that you might be given after surgery. So let's cover a few of these in more detail. Protein. Our normal protein requirements are 0.8 to 1 gram of protein per kilo of body weight. And more recent research is really suggesting that for healthy aging, perhaps we should be looking at a little bit higher levels to maintain the muscle that's on our body and to promote healthy aging. So maybe we should be suggesting 1 to 1.2 grams for people. That's what I like to recommend, especially for people over 50. For surgery, that increases even more. So we're looking at 1.2 to 2 grams of protein per kilo of body weight. There are many foods that are high in protein, so you don't have to look too far. Depending on what you usually eat, there's a variety of choices. So for vegetarians, there's options. For people who eat meat and fish and poultry, there's different options. What do you eat? And include good sources. So meat, fish, poultry, milk, soy milk, pea protein milk, yogurts, cottage cheese, regular cheese, beans, peas, lentils, nuts, seeds, nut butters, seed butters are all great options. So, but good to know that meat, fish, and poultry will give you a bigger bang for the buck in terms of how much you need to consume to get a greater amount of protein. So if you're not consuming those choices, it might be a little more challenging to get enough protein from the sources you do consume. So here are some examples of where you would get protein and how much you would need to consume to get a certain amount. If you keep track and find that, well, maybe I'm not eating often enough or enough throughout the day, maybe protein supplements could be useful. So adding some protein powder or purchasing high protein milk or high protein cereal or maybe nutritional supplements may be appropriate for you. Aside from protein, it's really important to consider other things that have a nutritional component. So if you've been really tired, well ahead of surgery, is there a reason? Have you had your blood checked recently? If you have any kind of anemia, so due to low hemoglobin, low folate, low B12 levels, you want to identify that well ahead of surgery. All the different types of anemia can be dealt with through diet, through supplements well ahead of surgery. It's really hard to get those levels up, a few days before surgery. So ask your doctor about your levels. More recent research is suggesting that maybe some additional vitamin C can be helpful. We know that vitamin C is involved with iron absorption. So again, if you're suffering from some anemia, you definitely want to make sure vitamin C is on board. Vitamin C is essential for collagen formation, wound healing, iron absorption, and maintaining a healthy immune system. So there's plenty of food sources that we get into our diets that contain vitamin C, citrus fruit for sure, but there's other sources. There's lots of vegetables like tomatoes, broccoli, bell peppers that are good sources of vitamin C. Juices are fortified with vitamin C from a time when we didn't have fruits and vegetables available all year long. So lots of different options. If you want to take a vitamin C supplement, 500 milligrams is a good place to start. That's probably all you really need. If you're taking 1 gram or more, then it becomes a drug at that point. The problems with taking, 2 grams of vitamin C is that it can have detrimental effects like destroying some of your red blood cells. It can cause diarrhea for some people. So more isn't necessarily better. Healthy fats. You want to include good choices when it comes to fats. We know omega-3s are beneficial. They have an anti-inflammatory effect. So making sure they're able to work. For them to have their full effect, you want to limit saturated fat in the diet, and that usually comes from animal sources. And you want to limit trans fats as well, so that those omega-3s work better. Trans fats, think fast food, junk food. The Canadian government lowered the amounts allowed in those choices a few years back. So our food supply is lower in trans fats than it used to be. Some good choices to include. So fatty fish, for sure. Those are great choices. The vegetarian choices, chia seeds, hemp seeds, ground flaxseed oil, pumpkin seeds, algae, walnuts, omega-3 eggs. Good fats to be emphasizing. My top picks are olives, olive oils, avocado oil, nuts, nut oils, algae oil. Don't forget about our plumbing. So constipation is a common side effect from surgery, from stress. Make sure you're prepared when you go home. You want good high fiber food choices available, and you want to spread them throughout the day. Nothing worse than getting one big hit of fiber at one time in the day and then nothing else throughout the day. So spread it throughout the day and make sure you have fluid on board so that that fiber works. If you have fiber without the fluid, it can actually end up constipating you more. So really important. Good sources of fiber, high fiber grains, cereals, breads, beans, peas, and lentils, fruits and vegetables, nuts and seeds. There is no fiber in animal products. And there's a great link to HealthLink BC has an updated handout on constipation and where to get fiber in the diet. Oops. And as Louise mentioned, you really want to stock up ahead of time. Think about, what are you going to eat? Is there going to be anyone else around who's doing the cooking? Stock up, make sure your fridge is stocked, your freezer's stocked, you've got things in the pantry. Make it easy so that when you go home, you don't have to stress about, what am I going to eat? And have some good healthy choices on board. Ask for help from people. You know, if there's people around that want to help, accept the help. And that's it.
Great. That was really helpful information. Before we get into the Q&A, we always like to ask our presenters, what excites you about the future for those diagnosed with arthritis or other autoimmune diseases today? Wendy, perhaps we can ask you.
Oh, sure. Thanks, Tara. So I'm excited about the research showing how much early intervention can make a difference for people who have arthritis in terms of neuromuscular strengthening programs. So really a lot of evidence that by building that support and stability through the joint, focusing on alignment and control with strengthening exercises, people can really bring down pain levels and improve function. So many of you have probably heard of programs like GLAD. That would be an example of a neuromuscular strengthening program. And certainly a lot of communities are starting to offer their own versions of programs like this. So it's something to seek out. Also, I'm excited about the fact that arthritis education is so accessible. There's lots to offer, lots on offer from the Arthritis Society. Also, our OASIS program offers many classes that are accessible throughout Canada. And it's really great to be able to take advantage of these resources. We know that the more information you have, the better able you are to manage this condition effectively. And final thing, for those going for joint replacement, it's always exciting to see changes to the actual surgical process. It's leading to shorter hospital stays, and people are having a quicker recovery, and they're getting back to their regular activities more quickly after surgery.
Thank you all for sharing your expertise with us tonight. And not surprisingly, we have received numerous wonderful questions. So a very important question, I get this a lot with my patients as well. Louise, I wonder if you can answer this one first. Someone is weighing the pros and cons of having to do one knee replacement versus doing both at once. Do you have any insights on that or recommendations?
Sure, Tara, that's a great question. And it's not an uncommon question. Very commonly with osteoarthritis in particular, you will have one knee that isn't great and the other one's not that much better. So it does become a question. However, it isn't just up to that individual. It is a conversation that definitely needs to start with the surgeon, because not every surgeon is going to offer that option. And people or clients have to consider that the medical risks of having both knees replaced at the same time is doubled compared to having just one. So there's medical issues as well. And even if you had a surgeon that does offer that to certain patients, it doesn't necessarily mean that that person would be a candidate for it. Having taught pre-op education for many, many years, I would think the most common approach is that people would generally do one knee to start and then get that second knee done at a later point, 9 months, a year, or something like later. Um, if you were going to have both them done at the same time, the other thing to consider is your hospital stay is going to be longer, your rehab is more challenging. So there's those considerations as well. If you have someone who is very limited on both sides, that's, you have to weigh those pros and cons. And that is, again, that discussion with the surgeon. But I would say more commonly, it would be you do the first knee and then you go through that recovery period with the plan to do the second. Doing them both at the same time is a challenge. You need to be physically ready for that. And so there is that balance there.
Thank you so much for that. Wendy, someone is curious about what exercises they should be avoiding before and after surgery. Wonder if you could take that one.
Sure. So prior to surgery, you really want to avoid those activities that are going to put extra load through the joint. So things involving jumping, bouncing, quick stops, starts, turns, these tend to be activities we call high impact. And that might cause more pain. If you're doing a lot of, say, pivoting motions, activities where you need that really advanced motor control and your joint isn't responding, it might not be as stable. We don't want you to end up injuring some of those soft tissue structures around the area as well. After surgery, generally people will work with their physiotherapist. They'll start initially with mobility exercises, start doing beginner strengthening exercises, progress those as able. And really the physiotherapist will be the best guide as to what should be done at what period in time. Some of the same principles apply in that we know that a joint replacement in the long term tends to last for a longer period of time if people are doing lower impact activities compared to high impact exercise.
Thank you. That makes sense. Arlena, this one's for you. Again, on the avoidance question, people want to know, are there any foods that they should be completely avoiding before surgery and after surgery?
Okay, so there are a number of foods that perhaps affect inflammation that people find when they do eliminate them, or really try and eat fewer choices, that they do feel a lot better. So paying attention to sugar is one I hear about all the time. When people are able to really cut down on their sugar intake, again, it has an effect on inflammation and people end up feeling better. Empty calorie foods. So foods that are high in calories without providing any nutritional benefit, you really got to think hard about this, especially for people who have been told maybe they need to lose a few pounds. We want to make really good choices and make them count. So things that are low in fiber, low in nutrients, perhaps more in the junk food category, or ultra processed foods, which are getting a bad rap altogether. And apparently, a lot of people, the population is consuming a large amount of these choices. So we know it's a problem. Really scaling back on those. Deep fried foods also have been shown to promote the formation of advanced glycation end products, and those end products are associated with an increase in inflammation. So get rid of the fried foods, the deep fried foods, especially before and after your surgery. Those are the things you really want to focus on.
Thank you. That's great. Wendy, there was a question about if it's necessary for somebody to be purchasing a cold therapy machine for their knee replacement after, or if simply ice packs is good enough.
Yeah, so a cold therapy machine is something that is commonly recommended by surgeons. And essentially, it's a machine where you put ice into it, but it circulates cold water around the joint through a cuff. So it applies compression at the same time. So I would say that people really like the cryo cuff. They find it's very comfortable. You can keep it on for longer periods of time, but it hasn't been found to be superior to using gel ice packs. So the cryo cuff can certainly be expensive to buy or even to rent. So it's really a personal decision. If you have the ability to get one or to borrow one from someone, you'll probably be happy with it, but I wouldn't say that it's a required piece of equipment to have a successful surgery.
Okay, interesting. Thank you. Luis, we're wondering if you have advice for somebody who lives by themselves and they have an upcoming hip replacement and they don't have any readily caregiver available. So any tips for those people?
Sure, that is a challenging one, and unfortunately, it's not uncommon. Um, Living alone is not a reason not to be discharged home. So you will be sent home if you live alone. You're going to generally be weight bear as tolerated, putting weight through that hip, that knee. You're not hopping around or anything like that. And when you're in hospital, they're making sure you can get in and out of bed, up and down the stairs, up to the toilet and back, those kinds of things. However, it is daunting when you're on your own. And I do encourage people to reach out and get some support if you can, if it's possible. Um, it's not available for everyone, but I think things like, say, for example, groceries nowadays, especially since COVID and things like that, online grocery delivery, meal delivery, use those options. I think they're really, really handy to have when you have, when you may not be able to get out as much. I think I hear more people talk about, say, house cleaning, laundry. Those are ones that are challenging. And if you don't have maybe family or other supports to help you, I would consider getting in some short-term help with that if financially that's a possibility. And this is again goes back to this whole premise of planning ahead of time. If you're 2 weeks ahead of surgery and now you're trying to find someone through a private home care company, they got to meet with you, they got to come to your house. Like this, these things take time. And so that's another thing I do encourage people, even for the first maybe, the first 6 weeks are going to be more challenging, but even the first 4 weeks, just having someone maybe come once a week to help with some laundry or cleaning would be a nice thing to have if it's an option for you. One other thing I do mention for people who live alone, and if you've had a hip replacement, there may be concerns about going up and down the stairs at night if you live in a two-story level. And if you have hip precautions where you need to use a raised toilet seat, one suggestion I would say, if you were by yourself and say perhaps your bedroom is on the on the top level where is your primary bathroom, but you come down to the living room and you're on your living room kitchen area on the main floor and you have another bathroom there. At nighttime, you're obviously going to be upstairs, and you may consider having a second raised toilet seat upstairs. So it's not that you have to go up and down at night. Can be a little bit reassuring when you're by yourself. And then having a neighbor or a friend sort of check in with you. Do let them know ahead of time, and I generally find that there are a lot of people that can help. But obviously, you want to plan for yourself and make sure that you have as many things set up as you realistically can.
That's a really good suggestion. Arlena, the next question is for you. How helpful are protein supplements or powders?
They definitely have a place for people who are not getting enough protein through what they eat. So um, I put up that list with a few examples of where you can get protein from. I also have a more extensive list that I can provide to Ashley to send out after the session today. Uh, so there are, start looking at labels, know where you're getting protein from your food sources. Something like, there we go, 3 ounces of fish isn't that big. So that is 3 ounces of fish. That'll give you about 25 grams of protein. So first figure out how much protein do you need based on your body weight, and are you getting enough at each meal? A good kind of way to sort of gauge it is, do you have at least 25 grams at each meal? If not, are there foods you can add in? If not, then perhaps protein powder can be stirred into something you're drinking, or maybe hot cereal to add a little boost. So it really depends on where you're starting from. It's not one size fits all. You have to really reflect on what you're currently eating. Is a protein powder going to be a benefit or not? I hope that answered.
Okay, definitely. Thank you. This one is for both Wendy and Luis. There was a specific question related to shoulder replacement. So we are seeing these more and more. Do we have any specific recommendations for people undergoing a shoulder replacement? So both from the exercise piece and from the home aids that may be helpful as well.
From an exercise perspective, it would be similar in that you want to try to keep the joint moving as much as possible. And certainly if you have an opportunity to check in with a physio and get some very specific exercise recommendations, that would be the best thing to do for that. Some people might be limited in terms of their, everyone will have different range of motion and strength. Some people might be able to do exercises where the joint isn't moving. Others might be able to do more exercises with TheraBand. So I think that's one of those things that's pretty hard to give a general answer to, because it can be so varied with the shoulder. But yeah, really it's maintaining as much mobility as possible without flaring up the joint, without pushing through that pain and actually causing inflammation. And then, that can really limit the mobility of the joint.
Yeah, and just to add on to that from an equipment perspective, if you're having a shoulder replacement surgery, obviously you're limited in that movement of that shoulder. So you're doing things sort of one-handed for lack of a better word. So how would you get dressed and those kinds of things, doing up buttons, and you might be looking at even simpler clothing with elastic waistbands. How are you going to open your jars and do different things at home? So I would be doing a bit of experimenting personally if I was going through a shoulder replacement, of going through everyday activities and starting to look at, oh, I do have a challenge with certain activities, and looking for ways to modify. There are some of those aids, as I mentioned earlier, like the reachers and things like that out there to help. But it is sort of planning ahead that you're going to be doing certain things more with one arm for a period of time, perhaps.
Yeah, it's a tricky one for sure. Thank you. Wendy, someone is having challenges with stairs post hip replacement. Do we have any recommendations on any specific exercises that might help them navigate the stairs a little bit better?
So doing the stairs would involve using those big muscle groups that I talked about, using the quads as well as using the glutes. And so if the stairs themselves are proving challenging, it would be really focusing first on those exercises that are building up the strength of those muscles. So after surgery, most people will work with a physio, be given some specific exercises. And sometimes it just takes time. Strength does not happen right away. It can take 6 to 8 weeks to see, huge gains in strength, like certainly less than that generally when people are trying to do stairs. But I would just really keep plugging away on those exercises, and it'll come slowly over time.
Yeah, that's helpful. Arlena, there's a few questions that came up about surgeons recommending that the patient loses weight prior to their surgery. Any recommendations on weight loss tips that may be helpful in this situation?
Okay, so it can be really challenging when you're not moving as much as you used to be. You're waiting for surgery, you're in pain. You blink, you gain a few pounds. So how do you go about losing some weight if you're not moving as much or you're in pain? And for some people, maybe that isn't realistic. Maybe just not gaining weight is realistic. So again, reflect on where you're at. Having good sources of protein, again, is really important. So to help with weight loss, you want to make sure that you are getting enough protein. This has been shown, a growing body of evidence to show that to maintain the muscle you have on your body and lose weight, the key is protein. Okay? If you don't have enough protein when you are reducing your calorie intake, then you will lose some muscle. And we don't want people losing muscle, especially getting ready for surgery. So that is really, really important. So, using that plate, you can't see, there you go, that healthy plate, using that as a guide can often help people improve what they're doing, and hopefully the side effect is losing a few pounds.
Great. I think both maybe Wendy and Louise can mention this, but what are your opinions on the GLAD program?
Yeah, so the GLAD program, as I mentioned earlier, is a great neuromuscular exercise program. It was developed specifically for people who have hip and knee osteoarthritis. And so if it is something that's available in your area, I know, although it's even available virtually, certainly something to look into. Sometimes a limiting factor can be the cost of the GLAD program. Because it is a physio-led program in a lot of centers, depending again on where you live in Canada. So it does cost a bit more, but that regular exercise focusing on those big muscle groups, focusing on alignment and control and progressions can certainly be really helpful. So if you have the opportunity before, you need some time before surgery because it's a 6-week program at a minimum, but definitely a good option, I would say. But don't rule out other programs potentially in your area too, because sometimes there's great community programs. Just go to your local community center and mention some of those specific words. Are there programs that are low impact? They do focus on alignment, control, all of these sorts of things to find an appropriate exercise program.
And just to add to that, the GLAD program, for those of you who don't know, it stands for Good Living with Arthritis, and it came out of Denmark, was where it was originally developed. And there isn't any secret exercise in it. I often tell people, it's exercises that have been put together. And I think the big thing I hear from clients and patients is it's that progression. Like Wendy said, it's a 6-week program. So each week it gets more challenging. So it really works on that strengthening piece. And I think for some people, if they've maybe plateaued with their exercise, it's a great program to really promote that development of strength and to work on things like balance, stability, as Wendy said, the alignment. So it is a great program for that reason as well.
Yeah.
That is Wendy said. There are other programs out there that do similar things too.
So important. Arlena, what do you think about certain oils? So the debate is it olive oil? Is it avocado oil? Is canola oil okay? So what are your thoughts there?
You know what? All of those are good choices. Um, every now and then we hear about problems with processing. So, what are people, um, how are the manufacturers making the oil? Are they following good manufacturing practices? Are you getting what's on the label? So, I mean, that's with a lot of different food products, but there have been some problems with certain types of oils, like grapeseed oil, canola oil, um, occasionally olive oil. So, it's just good to be aware of that. If you're getting good quality olive oil or canola oil or avocado oil, fantastic. Um, that is what I will say without opening another can of worms.
For sure.
Yeah.
Louise, there were some concerns about the costs of some of these assistive devices. I'm not sure if you have any recommendations for people on where they could borrow or source out some of these aids. And I know it kind of varies depending on where we are in Canada, but what are your thoughts on that?
Yes, it is a challenge. I do think that, starting locally is sort of the best way. Talk to family and friends. It's often amazing how many people have that raised toilet seat in their house or have an extra walker or those kinds of things. So I do encourage people to do that. Medical supply stores are one, but obviously there is that cost piece. One used option that I've used for myself personally, and I've suggested to clients as well, is called assistlist.ca. That's a website that sells used medical equipment. Now, sometimes you get into hospital beds and bigger items, but that's often one to have a look because it's specifically for medical equipment versus going to, I don't know, marketplace or something like that. Um, then, of course, there's the option of the Red Cross, and a lot of people will know about the Red Cross. Now, the Red Cross is a wonderful service across Canada that has equipment loan cupboards that has some of these pieces of equipment available for free for a certain amount of time. However, there has been a number of changes over the last number of years with access to the Red Cross because unfortunately there's just not enough equipment available for everyone. So people wanting to use the Red Cross, if they're not able to rent or buy equipment, then the Red Cross would be an option for them. You do need a signed form from a therapist or physician or nurse ahead of time to use the Red Cross, but it's not that everyone can just go and use it. There is supposed to be this kind of process that it's only there for people who um, don't have the financial means to rent or buy equipment. So I would never want someone to stress about, I can't buy this equipment or I can't pay to rent it. There is that option. Now, keeping that in mind, things like that high density foam cushion that you may very well need after hip replacement surgery is not available at the Red Cross. Those reachers and grabbers, they're not available at the Red Cross. The sock aids, not available at the Red Cross. The cryotherapy icing machines, not available at the Red Cross. So it has some of those other items, but those are the kinds of things I would try something like Assist List. Reachers, you can get dollar store versions. You're going to get a dollar store version. I those sort of things I like that you can get a good one because you'll probably use it a lot. So those are some of the suggestions. But again, just like we've said, and since the beginning of this, is that the earlier you plan this, the easier it'll be for you. When you're sitting on this surgical wait list, now is the time to start looking and exploring them, those options in your communities so that you're not a week away from surgery, or I've had it with people being days away from surgery and in a panic trying to find things. You know the things you'll potentially need, so start looking for those options now.
That's great. Thank you, everyone. And thank you all for sharing your knowledge with us today. We'd like to take a few moments to get the audience's feedback on today's presentation. For those joining us live, a poll will appear on your screen in just a moment. Please take a second to select the answer that best reflects your experience tonight. I feel more knowledgeable and empowered after attending this webinar. Strongly agree, agree, neutral, disagree, strongly disagree options. We will be sending you an evaluation when we email the recording and the slides. So if you are unable to access the poll question, you will have another opportunity to offer feedback at that time. We use the survey feedback to shape future Arthritis Talk webinars, and we truly value your input. We look forward to seeing you again in September at our next Arthritis Talk on osteoarthritis in the back. More information will be sent out about that webinar in the coming weeks. Once again, we are grateful to Pfizer and our other partners for their financial support of this event. Our Arthritis Talk webinars are only possible because of generous support from donors. If you'd like to support us continuing offering free resources and support, please consider making a donation at arthritis.ca/donate. This concludes tonight's Arthritis Talks. On behalf of all of us, thank you for joining us today. Please stay well.